At the time, he was an associate professor, PhD, and medical doctor. One of the most respected titles in Vietnam's healthcare system. He told me I needed surgery immediately, because your house is on fire. But I refused. I refused cancer surgery, the truth doctors won't tell you. There's a sentence that almost 99% of doctors will tell you when you ask about cancer. Surgery is the most definitive, curative treatment. It sounds certain. It sounds trustworthy. And in that moment, most of us simply nod, because we believe that must be the right path. But what if that's not completely true? What if I told you that because I understood this, I made the decision to refuse surgery, even after being advised to do so by two of the largest hospitals in Saigon? What would you think? I'm not asking you to believe me right away. I'm only asking you to stay with me for a few minutes. Because what I'm about to share is not theory. It's not something from a textbook. It's something I had to face, think through, and decide at a time when my life was truly on the line. And before we go further, if you believe there are truths in life that are not always fully spoken, comment 1. If you think everything is already clear and transparent, comment 0. Let's begin. Definitive, curative. Those words sound absolute. But have you ever stopped to ask yourself, what do they actually mean? Cancer is not a stone sitting still inside your body that you can simply remove and be done with it. Cancer is a process. It's a transformation. It's a system of cells that can grow, adapt, hide, and reappear. When you see a tumor, that may only be the visible part of something much deeper. So who can guarantee that once the tumor is removed, everything is over? Who can be certain that cancer cells haven't already spread? That they haven't moved beyond what tests can detect? That they won't return, months or years later? Everything we have is a diagnosis. And even the word, diagnosis, carries uncertainty. Medicine is not mathematics. In math, 2 + 2 is always 4. But in medicine, there is no formula that works for everyone. A treatment may work for hundreds of people. But you and I might be patient number 101. Or 501. And no one can predict exactly what will happen. There's something I deeply believe, and I want you to remember this. There are no two human beings exactly alike. Not in our bodies. Not in our minds. Not in our emotions, our life circumstances, or the way we respond to challenges. So why do we believe that one solution can apply to everyone? I'm not saying this to reject medicine. I'm not saying this to go against doctors. I'm saying this so you understand something very important. You have the right to think. You have the right to ask questions. And most importantly, you have the responsibility for your own life. Doctors prescribe. But you are the one who takes the medication. Doctors make recommendations. But you are the one who lives with the consequences. If things go well, people say, the patient was fortunate, the doctor was skilled. But if things don't go well, you'll often hear the same words everywhere in the world. We did our best, our condolences. And then, life moves on. Everyone returns to their own path. But the patient doesn't get a second chance. We only have one life. There's no draft, no rehearsal, no opportunity to redo it the right way. That's why I believe every decision about your body must be made with clarity, awareness, and responsibility. My son, Dr. John Nguyen, is a cancer surgeon. He has spent decades in operating rooms. He understands surgery deeply. And yet, he once told me something very simple, but incredibly powerful. Even a minor surgery, like removing a small wart, can still have complications. Pause for a moment and think about that. A surgeon warning me to be cautious about surgery. That doesn't mean surgery is bad. It doesn't mean no one should have surgery. But it does mean this. Nothing is 100% safe. Nothing is absolutely guaranteed. And when you understand that, you begin to see things differently. You no longer see surgery as a certain solution. You see it as a choice, with both benefits and risks. And then you begin to ask a deeper question. Is this truly the right choice for me? When I was advised to undergo surgery by 2 major hospitals, I didn't decide overnight. I thought about it. I questioned it. I observed. And most importantly, I listened to my own body and intuition. And in the end, I made a decision that many people considered unusual. I refused surgery. As I mentioned in a previous video, my medical record clearly stated, and even highlighted, patient refused surgery. Not because I was against doctors. Not because I disrespected medicine. But because I understood something. Each person's path is different. And I chose a different path. A gentler path. Less invasive. More focused on understanding my body, caring for my mind, and not allowing fear to control my decisions. Many people think refusing surgery means giving up. But for me, it was a conscious choice. A decision rooted in understanding and belief. And today, as I sit here sharing this with you, I'm not telling you to do what I did. I'm not telling you to refuse surgery. I only want you to understand one important truth. There is no single path for everyone. What matters is not whether you choose surgery or not. What matters is that you understand your choice. You know why you choose it. And you are willing to take responsibility for it. If there's one thing you remember from this video, let it be this. Cancer surgery does not completely eliminate cancer. It may remove part of it. It may help in many cases. But it is not an absolute miracle. And when you understand that, you stop living in illusion. You begin to live with awareness. If what I shared made you think differently, comment 1. If you're still unsure, comment 0. I truly want to know where you are in this journey. And if this message brought you value, share it with someone you care about. Not because they are sick, but because one day, they may face a decision like this. In the next videos, I will share something that may truly surprise you. A professional insight that almost no doctor explains clearly. The real, deeper, and most convincing reason why I refused surgery and still live a healthy life today. And when you understand that, you may begin to see cancer in a completely different way. I'll see you soon. Joseph Nguyen.